Auscultation of the heart is very important while doing the cardiovascular examination. First of all, turn on the stethoscope. We will check heart sound in different area: mitral, tricuspid, aortic and pulmonary area. First heart sound coincide with carotid pulse, second heart sound doesn't. So here we will auscultate the mitral area with stethoscope, and at the same time we will palpate the carotid pulse for S1 and S2. We will go to check for murmur, and then we will localize the murmur site, nature, radiation in relationship with respiration. Now we will auscultate the tricuspid area. It lies in the fourth intercostal space, while the mitral area lies in the fifth intercostal space. Now we will auscultate the pulmonary area. At the end, we will auscultate the aortic area for the murmur. Aortic area lies in the second intercostal space. So here we auscultate the four area: mitral, tricuspid, aortic. S4 and S3 is low pitch sound, so we will auscultate this sound with the bill of stethoscope. We will auscultate it in mitral and tricuspid area. So if there is a murmur in a mitral area, we will ask the patient to lie on the left side and will check for the mitral regurgitation murmur into the carotid area. If the patient is tricuspid regurgitation, we will check its radiation to the epigastric area. If the patient is aortic murmur, we ask the patient to sit and lean forward while auscultating the aortic stenosis murmur and its radiation to the carotid artery. At the end, we will ask the patient to sit down, and we will auscultate the base of the lung for crepitation. Like in heart failure, there will be pulmonary edema, and we will auscultate the crackle in the heart. At the end, we can also palpate the spleen in order to rule out the infecto endocarditis in a young patient presenting with a new murmur